broadcasting live 4 days a week worldwide
from the sunny beaches of Southern California.
This is ExtremeHealthRadio.com.
G'day, this is Joe Cross from the movie Fat, Sick and Nearly Dead and from RebootWithJoe.com. I'm on Extreme Health Radio with Justin and Kate, and we are juicing up the world.
Hey everybody, this is Justin, pre-recorded. I just wanted to let you guys know that the show number for this particular show that we didn't know at the time that we recorded it is episode 328. So you can get all the show notes and links and anything we talk about at extremehealthradio.com/328. All right, thank you so much, everybody, for joining us on another episode of Extreme Health Radio. And we don't even know what the show number is going to be on this one. ExtremeHealthRadio.com/ we'll figure it out later. We're not sure what the actual show number is going to be, but we thank you all for joining us. We really appreciate that. Typically, we broadcast live 4 days a week on Monday, Wednesday, Thursday, Friday at 9 a.m. Pacific. So if you guys would like to join the live show, you can do that. And if you guys would like to support our show, there are lots of different ways to do that. If you'd like to go to Amazon through our link, that's a good way to support our show. If you go to extremehealthradio.com/Amazon, you can make any and all purchases there.
Especially for holiday shopping. Keep us in mind, if you would, please.
That's right.
Buy anything. You could buy toys for the kids. You could buy
back-to-school stuff.
That's true.
Pencils, paper.
Pencils.
Anything you want. So that's a great way to support us if you guys want to do that. extremehealthradio.com/Amazon. And today we have a really fun guest in the studio, Dr. John Bergman, and he was on our show in April 22nd to be exact. And
I wasn't able to get on that show, actually.
You weren't on that show?
No, I was on jury duty.
Oh, really?
Boo.
Oh, my goodness.
I know.
You got out of it, right?
Well, I had to go for the day, but yeah, they let me out. They let me out at the end of the day. I didn't have to go back.
His website is BergmanChiropractic.com, which is BERGMAN and then chiropractic.com. And today we're going to be talking about arthritis, but all kinds of other health issues as well. But his website for that is thearthritisreversalsystem.com. And so thanks, John, for coming in.
Oh, thank you so much for inviting me.
Oh, it's just so much fun. I'm just so glad that you made the drive down here. And
I love driving.
I know.
You took the ocean way?
Oh, yeah.
Oh, fast. Man, don't we live in a great place?
It's gorgeous.
Hey, do you ever, speaking of the ocean, do you ever get concerned about the Fukushima issue?
It's not a concern. Just know that we're being bathed in radiation and that we have to, in order to live in California, you have to do certain things to counteract it.
Yeah.
Because the cells are breaking down. And the thing with radiation, if you build them up faster than they break down, you got health. If they break down faster and you build them up, you're not going to be here that long.
So you have to sort of adapt to your strategies if you want to live
survive.
Here. Yeah, I know certain states have their own different things. I know Texas has got really bad air quality. Don't they have one of the worst air qualities in the nation?
Oh, yeah. And a lot of the middle states are like Indiana, Kansas. I've got a few patients that came out from Oklahoma, and they're severe respiratory illnesses.
Really?
Yeah, it has to do with the amount of pesticides and GMOs that they're getting in their water system and their air system. It's devastating.
Really?
You get a couple of patients from Illinois or Oklahoma and north part of Texas. It's a whole different animal than a Californian.
Wow. And so you can measure all this stuff and find out their history and all that?
Yep.
Oh, my goodness.
So what does that look like when they come in? How do you start to do the assessment? Like, what's the first step of that?
The first step, the way we assess it, is we do a consultation. Because a lot of people come in with arthritis symptoms or high blood pressure, high cholesterol, or depression or anxiety. It's like I just talked with a patient from Brazil who her daughter was calling up for Alzheimer's. And so all of those have a source. Okay, as to why the symptoms there. And so it begins with a consultation to find out what their history is. So when you're talking Alzheimer's or, arthritis, why did it occur? It's not that it's a destiny of everyone to develop joint pain or altered brain function. You got to ask the question, why? So why would somebody's joint start to hurt, or why would the brain start to malfunction? And it turns out with this gal in Brazil, it began with indigestion. Okay, and when you go in, you find out a little bit further. Before that, she started to have ankle pain and knee pain. So this is the cascade of insanity. For ankle pain or knee pain, they're given typically a pain reliever, like a non-steroidal anti-inflammatory, even though the way most of those work is they inhibit a chemical called proteoglycan production, which is the building block of cartilage. So they're given a drug that irritates the lining of the stomach, and then that causes the body to destroy their joints, but they're comfortable. So then, since it irritates the lining of the stomach, then they're given an antacid.
Oh my goodness.
Now, you need acid in the stomach in order to absorb minerals.
Yeah.
So then your body becomes calcium deficient, magnesium deficient, and you can't break the proteins down. So you're missing the amino acids to rebuild the joint in the first place. And it's just like, oh my gosh.
It's just a cascade, isn't it?
Yeah.
And it's crazy, too, because isn't stomach acid your first line of defense against colds and flus and things? Right?
Exactly.
So you're more susceptible?
It protects you from a lot of viruses, funguses, and bacteria that could be pathogenic or damaging. But it's essential to absorb minerals, because most calcium and magnesium and iron are absorbed right next to the stomach in an area called the duodenum. So anybody taking an antacid, and this was driving me crazy a few years ago, medical doctors, I'd have patients being prescribed Tums, because what do the commercials say? What's better for you? Rolaids with aluminum salt or Tums with calcium? And it's like, dude, how insane!
Oh, man.
You mix calcium with an antacid, you're going to be calcium deficient.
Yeah. That's so sad. And isn't the antacid industry, it's one of the biggest, it's like billions of dollars a year, isn't it?
Oh, God, yeah. If you had no morals or ethics, it'd be a good investment.
Wouldn't it?
Yeah.
Because it could be one of the main things. I mean, I don't know how you would stack up something like that, versus vaccinations or flu shots, but I mean, everyone is taking. People that say they don't take flu shots or vaccinations, they'll still take a Tums. Mm-hmm. You know what I mean? And it's
don't
it's
think
amazing.
twice about it.
Yeah, they think it's fairly benign.
Yeah.
But if you take a chemical to alter your physiology, knowing that your body is self-regulating and self-healing, that's not a smart move.
No. No, because
So
it's gonna. Okay.
Doctors actually prescribe Tums and antacids for people as part of their daily protocol.
What is bizarre is when I get an infant in, and we're talking like 1 to 2 to 3 months old, taking an antacid.
What?
Really?
It's honest to goodness. It's jaw-dropping. Now, these are educated parents. Okay, typically the mom or dad, they've seen a traumatic birth in a hospital. Uh-huh. You typically don't have traumatic births at home because that's a more normal environment.
Right.
So this kid is wrenched out. The mom has been given a cow hormone to initiate contractions called Pitocin.
Right. That's a cow hormone?
Yeah. And well, what's interesting, when you look at how birth happens, if you have a mouse or a rat that goes into the birth process and move their cage, the contractions stop. If you take a human being who begins contractions at home, typically, in a safe, nurturing, loving environment, oh my gosh, let's get to the hospital, hurry.
Yeah. So, well, we're taught that, aren't we?
We're taught that. But in the old days, the poor people were the only ones that would give birth at a hospital. Okay, the wealthy would give birth at home. And we're starting to go back to that. Where the wealthy, educated people are going to get the doula and have the birth process set up at home where it's safe. Well, when the mom gets to the hospital, the contractions have stopped because of the white lights, the baby monitor, the needle in the arm for the IV.
The stress.
That's incredible stress. It puts her in the fight or flight state.
Wow.
So and that's part of the automatic or autonomic nervous system that prepares her for battle. So she's not going to want to nurture that kid into the environment.
Yeah.
So, of course,
after birth, then.
Oh my gosh, dilation's going to stop and everything else. So,
wow.
give a cow hormone or Pitocin, even though the Pitocin increases risk of neurologic damage from the vaccines about 60%.
You mean the vaccine's given to the child afterwards?
Afterwards.
Really?
Yeah, it hypersensitizes their immune system.
So now that's something I didn't know, because I knew about Pitocin and the potential damage that it has, but I didn't know it increases the potential for vaccine trauma or damage.
Oh, it's mind-boggling.
Wow.
And what's wild, too, is if you've ever seen a natural birth, and most obstetricians never have, because they look at it as a medical procedure, there's a beautiful dance between the mom and the kid, and this totally interrupts it. So you get this massive contractions that just jam that kid's head up against the cervix, and of course the cervix swells up, causes pain, and the mom's given a pain reliever, an epidural.
Wow.
And then the kid finally comes out. So the kid is going to have, trauma to the neck and be stressed.
And drugged out,
and
right?
drugged out. Oh, yeah. It's a chemical assault. And there's only 3 stressors: physical, chemical, or emotional. So the kid's already been emotionally damaged because birth shouldn't be like that, and chemically damaged from the Pitocin that crosses the placental barrier, and then the hepatitis B vaccine within 12 hours. So the kid's stressed.
Wow.
And under stress, your body prepares for battle.
Yeah.
So blood supply to the gut's going to be shut down. There's going to be difficulty in sleep. The muscles on the spine of the child are going to be increased in tone. Just like you'd see a cat, like a Halloween cat that's stressed.
Yeah.
Human beings are the same way. Those muscles are called postural muscles. They increase in tone. And this is how we check an infant at our office. We'll check for increased tone of those muscles. We'll check for inflammation or sensitivity around the neck. And to give an antacid to a child who's spitting up without asking why. The kid could have trauma with the neck, trauma with the pelvis, the chemical assault. But usually it takes about a day or 2 to get the kids off of any antacids and processing nutrients.
Wow.
So that's like when parents complain about the acid reflux. That's what they're trying to keep down.
The little kids spitting up all the time. That's the complaint.
Well, that's actually true, because our youngest niece, she was on that for the first year of her life because she would not stop screaming.
She was on
antacids. When you think about it, because the acid reflux would not. She was in the hospital. She was hospitalized because it was so bad, and then finally the pediatric hospital put her on massive amounts. And I have to wonder what the heck that's doing to kids.
Oh no, you don't have to wonder.
Don't you?
Oh, it's kind of cool because in a sick sort of way, it's like an animal experimentation. And just think about it: if you're decreasing the acid in that stomach, they're calcium deficient and iron deficient, so they're going to have low energy and have emotional issues. Okay, if you add in the assault of the chemical foods, the modified foods, and the shots, estrogens, the vaccines, forget about it, because those are foreign animal proteins injected into the system,
to the bloodstream,
and that's mind-bogglingly insane. But just looking at the loss of calcium, magnesium, and iron, low energy, emotional issues, and growing pains.
All within the first couple days of being born.
And if you like your niece, when she's a teenager, oh my gosh, she's going to have all these stressed out symptoms that don't, and they could still be solved.
That's what's so amazing about the human body, isn't it? They can still be solved.
What's a trip is most indigestion or reflux is from not enough acid. There's never been a case of where there's too much acid in the stomach, because there's sensors on top of the stomach that once acid hits that stomach lining, it tightens up. It's called the lower esophageal sphincter.
Okay, yeah.
Now there's nerves that supply that govern the sensors. But if that muscle, the lower esophageal sphincter, the muscle on top of the stomach, doesn't tighten up, acid can slosh up into the esophagus, and then people say, wow, it's uncomfortable, or I can taste my lunch again. Or, yeah. And it just means that they've got either a sympathetic dominant problem, or an imbalance in the nervous system, or they're eating toxic food, or there's something wrong.
So when a baby spits up, because like you just mentioned a couple seconds ago about how a baby, with the antacids, it affects their sleep cycles and ability to fall asleep. And everyone that has babies is worried what kind of pattern they're going to. So with all these things, with the baby, you can basically tie this back to a lot of it, back to antacid problem.
Huge. Well, also to birth trauma. Because when I get, like this past week, I got a 12-year-old kid from Texas. And she couldn't sleep at other people's homes. It took her a long time to sleep, to get to sleep now. And she was a little on the nervous side. Uh-huh. And that was her complaint, nervousness and knee problems. And so the first thing I asked, was she born at home or in hospital? Uh-huh. Hospital birth, okay. Was the mom given Pitocin and an epidural? Yep. Okay, did she have ear infections? Yep. Because the ear infections are a clue to trauma from the upper neck area.
What happens there that causes that?
What's interesting, it's not an ear infection. And you're going to ask moms, has your kid ever had an ear infection?
I did.
I have so many.
Yeah. And it's not. They think that it's normal. They'll say, oh no, only one or two. It's like, oh my gosh.
Only one or two.
If you had an ear infection at all, for one, it's not an infection. Okay, the British Medical Journal did a study, and they actually looked at the fluid. The way an ear infection is diagnosed is the doctor will look in the ear, and they'll see the eardrum, and it'll be a red, bulging tympanic membrane, and red, bulging, and inflamed. They'll think, oh, it's an infection. British Medical Journal went in there, dropped a needle in there, drew the fluid out, and found out 93% of the time it's sterile.
Really?
So it's not an infection. It's an ear effusion. Okay, and that's totally different. Now, the ear, the middle ear drains through a tube in the back of the soft palate called the eustachian tube. Okay. Now, there's a muscle that controls that tone. It's called the soft palate. The nerve that controls the soft palate comes out of the top of the neck. So if the top of the neck has been traumatized through birth because of the, inappropriate birthing process.
Right. How they pull the head and
the Pitocin.
Get you on out of
there. Just nasty.
So the nerve gets damaged a lot of times, or most of the time.
Most of the time.
Most of the time.
Yeah.
Wow.
And if that one's damaged, in particular the one that controls the palate, every time, and you could try it, even the listeners can, swallow. What happens? You hear your ears pop, or you should.
Yeah.
You just flex the soft palate.
Okay.
Well, these kids, they can't, their palate doesn't flex when they swallow, and so the ear can't drain, so it fills up with fluid, and the kid cries, and so then they're given antibiotics.
Wow.
So what does the antibiotics do? It causes holes in the gut, so leaky gut. So then you get this kid with trauma to the neck. Then they're treated with a poisonous mold or an antibiotic that causes holes in the gut that allows large undigested proteins to get into the system.
Into the blood.
And then those large undigested proteins, particularly if they're gluten or casein proteins, the body's going to recognize those proteins as pathogens, as dangerous. So it's going to build antibodies to those. And if you build antibodies to the gluten and caseins in, like, the milk and the food that they're giving the kids and stuff, those look really, really similar to antibodies that attack the thyroid. So then these kids are going to be in an adrenal stress. They're going to have low-functioning thyroid. They're going to have swelling of the abdomen. They're going to have difficulty in sleeping. They're going to have all of the symptoms of this. And then they're diagnosed with attention deficit disorder, or so. I mean, that's a heck of a tangent we just got off on.
No,
but imagine this. Okay, so the 12-year-old kid comes in. Okay, so she's stressed. Was she born at home or in a hospital? Hospital. You already know the damage. What, did you have ear infections? Yes. Only one or two. Okay, good. So I know she's got leaky gut. I know she's got neck trauma.
Did she have antibiotics? Only one or two.
Yeah. Only one or two courses. Okay. Right. Okay, so then she hasn't been able to digest protein. She's got a leaky gut. She's been in a stress state forever. So she comes out here. We identified, sure enough, the top bone in her neck was spun sideways on the x-ray. She had 100% loss of curve in the neck. I mean, and you've got the cardiac and respiratory center in the neck. You've got...
It's all there, isn't it?
Oh, my gosh. And sure enough, I mean, she'll be here for a week. By the end of the week, she'll be sleeping fine. We'll change her diet. She'll be okay.
So can you reverse people that have taken the antibiotics and things like that with the leaky gut and things? Is that possible?
So quickly.
Really?
Oh, you're so lucky to be human. Honest to goodness. Do you know that, you could take a hunk of the colon out surgically.
Yeah.
So the two ends together, 24 hours later, you can go in with a colonoscopy, you can't see the joint.
No.
Oh, my gosh. Just to be human alone, you should walk by the mirror and smile.
Yeah.
It repairs so quickly.
That's amazing.
So to heal the lining of the gut, very, very simple. Find the problem first. And this is where a lot of natural healthcare professionals and virtually all the medical, God, I'm looking for an adjective. I can't say medical professionals because I disagree with that.
Okay,
to treat
personnel.
symptoms with a
personnel.
Medical personnel. Yeah. Excellent. Oh, good.
We'll go with that.
You rock. Okay, the medical personnel or the chemical approach to healthcare, if they're not asking why.
No.
Why? Why does a kid have indigestion or a kid have trouble sleeping or an adult have joint pain or, none of that stuff makes sense.
No.
So you ask the question why, and particularly when it comes to gut issues. If the person has, like if I went up and stood on your toe, you'd probably punch me. Okay. but if I caused you an irritant, okay, that's going to put your body in a fight or flight state. It's going to dilate the pupils. It's going to decrease blood supply and nerve supply to the gut. It's going to put your body in a stress state. Cortisol is going to be secreted, which is a brilliant anti-inflammatory. Adrenaline's going to be secreted, norepinephrine's. All the stress hormones are going to be preparing you for battle, not for digestion.
Yeah.
So find the sympathetic dominant or find the stressor that's causing the leaky gut first.
And we were talking to someone who just recently was saying that anytime a baby's born, she was a really fascinating woman, but she was saying that anytime a baby's born, for the first 2 days, they have leaky gut until they feed on the colostrum from the mother to help
seal it up.
Yeah, is that what it was? To seal it up and to line the inside of the colon and the intestines. And it seems as if, you probably know this really well. With arthritis, there is a connection, isn't there, to leaky gut?
Huge.
Is it
Huge.
always, or is it most times, do you think?
I'd say probably at least half.
Okay.
Because when you got leaky gut, there's a problem with digestion. That's like a duh.
Yeah.
But the way that the body regenerates itself is through healthy blood. And to get healthy blood, you have to have healthy proteins. To have healthy proteins, you have to be able to digest the proteins down to amino acids.
Okay.
So you can regenerate the joints and regenerate or the blood cells, because your blood's replaced every 120 days. Man, you give yourself an infusion.
Wow.
Every 120 days.
Brand new blood. Every one of my 6 million red blood cells brand new.
120
days.
Oh, I know. Isn't it cool to be human?
That is wild. It is cool to be human.
Well, you have a friend that's that has
major
rheumatoid, right? Arthritis. And she's our age. And so it's I'm sure you're seeing it.
So debilitating.
Yeah, it's completely debilitating.
But it's actually reversible.
It is reversible.
Well, you figure the only way that you can diagnose rheumatoid arthritis is joint pain, severe, and then it's going to be sometimes symmetrical, sometimes not. And there's a lot of things that's not definitive for the diagnosis, but it's a blood test called RA positive, rheumatoid arthritis factor positive.
Right, and that's exactly what she had.
That blood test can change into RA negative.
Oh, really?
Yeah, because all it is the body working correctly, attacking incorrect structures. So since you've got antibodies that are going in and attacking the joints themselves, you have to change the immune system's awareness of the body.
How would one do that?
Well, first, since the nervous system controls and coordinates every function of the body, you got to start at the basics. If you walk in a room and the light's not on, you don't call the power company. You check the light switch, and then you check the, the bulb, and then, so start at the basics. Check the nervous system first and find out where the history is.
Okay.
Did she have courses of antibiotics, in the past, causing a leaky gut, causing proteins to be put in the system where they shouldn't be. Mm-hmm. Yeah, I mean, forget, the flu shots and vaccines, right, because the whole result of vaccination is to get foreign proteins into areas that they shouldn't be.
Right.
So the body can recognize it as a pathogen, and then they build the antibodies towards it. That's the actual purpose of the vaccine.
That's the goal of it, right?
It's like, wow.
That's amazing.
You couldn't be that ignorant about human beings unless you really stick your head in a hole. And so she already has, if she's had vaccines, flu shots, anything similar to that, or antibiotics, that's the source of where the rheumatoid arthritis came from, is the antibody production. So then you have to get the nervous system working correctly, heal the gut second, and then find out where the source of it was. So if it was the foreign proteins or the heavy metals from the vaccines causing an abnormal response, get her on a heavy metal detox, oxygenate her blood, do some type of chelation therapy. And
what if people have a disfiguration that's already starting to occur in the joints? Because once you heal the gut, then you solve the problem, mm-hmm, from occurring. But then you also have to then deal with that, right?
Exactly. So regenerate the joints.
Yes.
If you're talking the upper extremity, like the hand, wrist, or elbow, you got to look at the neck as the source of that. But if you have just one particular joint, the best way to regenerate that joint, because joints, they're only about 14, 15 months old. So that joint is distorted because it's been regenerating itself in an incorrect design, in an
disease
adaptive
process.
A disease process, but more like an adaptive disease process.
Okay.
Because since that joint isn't getting the appropriate proteins, or the cells that live on the cartilage, the chondroblast, they weren't getting the appropriate message to regenerate, or the body actually built antibodies to destroy that cartilage, and that's why the cartilage is being destroyed. Whatever the factor that caused that joint to be distorted and break down, mobilize the joint as best you can. Because the more mobility to that joint, you're going to, particularly if you distract the joint, if it's fused, it's fused. You can't do anything. But if there's even the slightest movement, any type of movement to that joint is going to cause inflammation. Okay. And that's going to cause, that's how the body repairs itself.
Okay.
And this is the complete shift in thinking that needs to occur with the medical, what did you call them?
Personnel.
Thanks.
Yeah.
God, you're so politically correct. God bless you,
How about
Miss.
the medical peeps?
Medical peeps.
So we say it here in SoCal.
Good. Okay, good. The medical peeps and even the natural healthcare. A lot of people are thinking about inflammation as being bad when it's not. It's the body working to correct a problem.
So if someone has deformed joints and they're in a disease process, should they? So you said they should mobilize them.
Start by fixing the source of the problem. Okay. Then, if that's from a leaky gut or an immune system response, then restore the nerve supply to it. If it's upper extremities, it's from the neck. If it's lower extremities, it's in the low back. Okay, really? So you have to restore the nerve supply to that joint so it gets appropriate signals. Because the nerves, they even control the blood supply to it. They control the drainage. They control the vasodilation, or more blood supply or less blood supply. So the nerves control every function of the body. So fix the immune system problem that caused it. Restore the nerve supply. Say we're talking about the fingers. Fix the neck. Restore the muscle balance of the forearm, because typically you should have the muscles on the back that are called extensors just about as strong as the muscles on the front.
So they should be equal.
Just about. It's a 5-to-4 ratio. The flexors or muscles on the front are about 5, and the muscles on the back should be about 4. So
4.
And that's not common in today's society, but that's how the system's designed. And then mobilize the joint.
Wow, it almost seems like the opposite. Oh, go ahead. Yeah.
Let's say you do that, but the emotional component, like with my friend's case, it was brought on right after a major family loss.
Huge.
And that's when it just, boom, hit her and it immobilized her. So I'm thinking, what if you deal with all the structural and, gut issues, but you still are holding on to that. Can people not get better and stay in that just from their pure mental state?
Oh, you can't get better unless you address the emotional component.
It's completely related.
So you got to do them both.
There's 3 stressors: physical, chemical, and emotional. When we're talking about the vaccines and detoxing and finding the source, that's pretty much the chemical.
Okay.
The physical is going to be a mechanical distortion of the neck or the joints themselves.
Okay.
And the emotional. All 3 aspects have to be corrected. I mean, or addressed.
Have you seen people just stuck in everything, in just in the emotional part, where they've done everything else and they're so frustrated?
That's actually pretty easy to correct.
Really?
Yeah, because you got to make them aware and change their perception of their body's ability to regenerate. And a lot of people are stuck in a paradigm of I'm sick, I'm hurt. And
I'm not going to get better.
RA.
Yeah, I am this.
Take on that diagnosis.
A label.
To identify with the disease is devastating because they won't heal. But if they identify with the beauty of their body, that it is responding correctly, and it's a huge shift.
That's a big difference.
That swollen, distorted, ugly joint, in particular when you're talking about girls. Okay,
Yeah.
they're looking at their funky looking hand.
Yeah.
That's an intelligent response to the body to regenerate, and you can fix it. It's so beautiful because bunions on feet, and some
Not
women
pretty.
are not pretty,
Yeah.
but they go away.
But they go away.
I've got the sweetest gal. She's 78. She's been with me about 4 years. She always lays down on her back and she says, "Look at how pretty my feet are." She used to have horrible bunions.
Oh, really?
And they went away.
Whoa.
Because the same thing, and you already know. How would you fix the bunions? First, you got to change the mindset that the bunions aren't a growth, that it's an adaptation or an adaptation to environmental stimulus. You fix the diet and nutrition and clean up the blood supply to the joint. You fix the nerve supply to the joint and then restore the mechanics.
And then work on the body's ability to believe it can heal.
Absolutely.
Something happens mentally because I had these things that were taking over my hand.
Little warts.
For 5 years. They were these giant blistery bump things.
Oh, yeah, they were. Yeah.
Went and got my root canal tooth pulled out in March. Went away within 2 weeks. They had gone back down into looking like a regular finger. Had these things for 5 years. And I tell you, once you get a taste of something like that, you believe. It's almost like you have to have proof before you believe it. But now I believe anything. It's like my body is working with itself. I'm not fighting against this thing that's attacking me. It's just a shift that took place. And now I think I just don't view health and anything the same anymore. It's wild.
Yeah.
The mind is the key. I mean, I've seen brain tumors, breast cancers, uterine tumors. I mean, all these different types of tumors and cancers go away. And
firsthand, you've seen it.
And the first primary thing is get the person to understand that it's there for a reason. And then they look at their body as health is natural.
Yeah.
It's not something you got to work towards. It's
like a default setting, right?
Yeah, man.
It should be.
Goes back to health every time.
Yeah.
Even distorted joints and depression and anxiety, those are all an appropriate response given the environmental stimulus.
Yeah, and it's funny because changing the perception of the beauty of the human body, that's such a big paradigm, because you look at different people, they go in for skin, to the dermatologist, and they look
the skin peeps.
Yeah, the skin peeps. They're always looking for something wrong. Mm-hmm. You know what I mean? And it seems like if you keep looking for something wrong, eventually you're going to find something wrong.
Yeah.
But if you have a shift in your paradigm and thinking, okay, maybe my digestion's not working well today or tomorrow, maybe that's just the body's cleansing response, or changing the way you look at things is challenging.
Having every patient ask why.
Yeah.
Oh, okay, I've got basal cell carcinoma. Why, doc? My other arm was just exposed to the sun.
Yeah.
Why?
Yeah.
Why? How come? My neighbor was in the sun as much as I am. How come I got it and he doesn't? Why? So if the doctor can't answer that, then the doctor's stuck in a paradigm of thinking that the basal cell carcinoma or skin cancer is a problem. It's not. It's a clue that the body is not functioning correctly. And it's the same thing with indigestion or arthritis or anything. Why? Why would this finger and not the others be distorted? Okay, in rheumatoid arthritis.
Right.
Why? And that, once you get that thinking, that critical thinking, that's not taught in schools.
Yes.
I mean, I taught chiropractors. And it takes a few more hours, I think about 250 more hours to be a chiropractor than to be a medical doctor.
Oh, really?
And, we take more pathology, more anatomy, more physiology, and way less pharmacology.
Yeah.
And so to pass the boards, you're just taught memorization and regurgitation. You're not taught critical thinking.
Yeah.
And critical thinking hopefully happens when you're out in the public. And a lot of people never develop it, particularly the medical personnel.
Yeah, I can understand, because at some point, as a medical doctor, you have to see a certain amount of patients per day. You're busy. You've got all these stresses with family. I mean, what time do they really have to do any research or to start thinking outside the box? But hopefully it's a paradigm that's changing.
Oh, it is, absolutely, because people are listening to shows like this. Mm-hmm. They're starting to question where the symptom came from. And what's neat in the medical world, they're not paid to get people off of drugs. If you're on staff at a hospital, you have to justify your position on staff at the hospital by ordering tests or prescribing.
Really?
Because if you don't order a test and you don't prescribe, then you're not doing billable hours. So it doesn't justify your position on staff.
Yeah.
Good Lord.
Isn't that wild?
Well, this is why. I mean, if you've known anyone that goes into the hospital for, a sore leg, what do they have? They get the neurologic consult, then they get the psychiatrist, then they get all these different, billable hours.
Yeah.
This is why, a day in the hospital is $20,000-$30,000. I mean, the beds aren't that comfortable. It has to do with
You're not getting a sleep number bed there.
Yeah. And the food isn't that good either. Yeah.
Wow.
Gee.
That is just amazing. This would be a good time to take a break, right?
Let's do it.
Okay, we're going to take a little break. We're with Dr. John Bergman. If you guys are interested in his website, particularly the Arthritis Reversal System, it is thearthritisreversalsystem.com, and his main website is bergmanchiropractic.com. And do you see patients? I see you have a Skype package.com.
Yep.
You see patients over Skype, is that right?
Over Skype, yeah.
That is so cool.
Yeah,
cool.
That's usually for out of state or out of the country international consults.
Okay, and you do those throughout the week, and
I try and pack them in on Friday.
Okay. Wow, and what is the owners-guide.com?
That's a free site to everybody in the world for 7 days. Or for our current patients, they get it for as long as they're a patient.
Oh, wow.
You get all our videos, all our handouts, all the research, everything.
Oh, really?
And we do it to disseminate it out throughout the world.
Wow, that's really cool. So people get that for 7 days, and then they can get that afterwards through a paid system or something if they want to continue.
Yep, absolutely. I think it's only $50 for 6 months, but the first 7 days is free.
Oh, that's so cool. Awesome stuff.
Yeah, the Owner's Guide is my favorite site. I love that one. Yeah.
That's so cool. And then the Arthritis Reversal System, we'll talk about that after the break a little bit further. But we're with Dr. John Bergman, and this is episode...
We don't know.
We don't know. We'll figure that out later, and we'll be right back right after this break. I wanted to tell you about this really powerful and unique product called the Q Laser. Did you know there's over 2,500 peer-reviewed clinical research studies showing the benefits of low-level laser therapy on the body? We had Dr. Larry Lytle on episode 165 talking all about it. Dr. Lytle, what is the Q Laser?
The Q Laser is a light-delivering device, handheld, rechargeable, that is for lay people and professionals, that works at the cell level of the body to restore energy. Since the body is all composed of cells and the cells are composed of atoms, it's good for any and everything in the body. It is especially beneficial for injuries. It will reduce swelling and inflammation before your eyes. Literally, you can have a sprained ankle and fly the laser, and within 30 minutes you can see that the swelling in the ankle has been reduced. Since all disease is inflammatory, you can assume that the same process is working if you have some type of intestinal problem. We have pictures of using a heat instrument to diagnose the intestinal inflammation. We can show that intestinal inflammation is pretty much gone within 3 minutes using the Q1000 laser. It's the number one tool in your medicine cabinet. I have a saying, never leave home without your laser. I have had 3 serious burns, and each time I had my laser with me, I applied the laser immediately after I had the burn. I never even blistered.
Kate and I don't want to be without ours. We've worked out a special deal with Dr. Lytle for all of our listeners. If you'd like to learn more about how the Q laser can dramatically improve your health, go to extremehealthradio.com/laser. I have to say, I have been absolutely loving this product by Tristan Truscott and Peter Ragnar called Good Morning, Good Evening Qigong. If you want to listen to the interview we did with Tristan, you can go to extremehealthradio.com/127. And Qigong is a great way to de-stress the body. And as you know, there's a huge component to disease caused by stress. And stress is a huge factor in how we live our lives and the amount of energy we have and the amount of vitality we have. And so, Dr. Shade, what do you think about Qigong?
People come to me and they're really sick and they got this blown out neurological system and all this toxicity, and I tell them, you need to do Qigong, Tai Chi. You need to do these things that settle down and restore your neurology, because it puts together all the parts. It puts you back into that state where you can start to detoxify. And so I highly, highly recommend all that.
And what about you, Kit Campbell? What do you think about Qigong? Do you like it as well?
Qigong is amazing. And the reason that I believe it to be amazing is everything here is energy. That is a scientific fact, if there ever is one. So when you're practicing Qigong, you're actually drawing energy into your body. Your intention, whatever your intention is behind any action, will determine the level of energy, type of energy that you absorb into your body. So your intention behind is very important, just like thought. So when you're practicing Qigong, you're actually bringing energy in and you're bringing out the stuff that might be a bit stale. With Tai Chi, it's totally different. The energy runs underneath the skin because it's more of a martial. This is the Chinese understanding, by the way. It's more of a martial art. So Qigong is very, very good for bringing that energy into the body, and just fantastic.
If you're interested in picking up this Qigong course by Tristan Truscott and Peter Ragnar, go to extremehealthradio.com/Qigong. That's QIGONG. And you can learn more about it. There's a great video on that page, and you can learn more about it on that page. And I highly, highly recommend this product. I love it myself, so go ahead and check that out. extremehealthradio.com/Qigong.
Listener supported. Extreme Health Radio. Opening minds and transforming lives worldwide. Don't forget to join our thriving community for health tips, inspiration, and show updates at extremehealthradio.com/Facebook.
That's it, Kate.
Tallahatchie, roll over me.
That's got to be it.
I think that's what he's saying.
I think it's Tallahatchie, roll over me. We're going to have to look into that.
We've been trying to figure it out for 2 years.
We still cannot figure that out.
I love it. It's
Thanks,
groovy.
everybody, for joining us on another episode of Extreme Health Radio. We so appreciate you guys being on and listening. This is episode number, so we'll figure it out later. And you are listening to Dr. John Bergman from BergmanChiropractic.com, as well as the Arthritis Reversal System.com. And we're having a really good time here. So getting a dose of really good information. So I wanted to ask you about the Arthritis Reversal System website. How did that begin, and what was the process of that?
It actually started with having to answer so many questions because we get, hundreds of nurses. We probably have maybe about a dozen medical doctors now as patients. And they're taught something totally different. I had an orthopedic surgeon started care with me about 2 years ago, and he started with me because his hands were going numb. And it's coming from the neck, okay, because he had compressed discs in the neck. And I told him, I said, well, Doc, your discs are alive. They're made of He said, discs are alive. I said, yeah, they're living tissue. Yeah. You know, they take in nutrients, produce proteins, eliminate waste products. The disc, you don't have any dead tissue in your body.
Yeah. Unless you have a root canal.
Unless you have root canal. Yeah.
True.
Yeah. So when you look at that, it's like dude, if it's alive, you can change it and they can regenerate. And bone spurs, there's a law in anatomy and physiology called Wolff's Law. Bone is laid down where it's needed, resorb where it's not. And so when you look at bone spurs, particularly in the neck area or low back area, those are not degeneration. It's that the disc has lost its height, so the body changes the shape of the bone in order to adapt to an unstable structure. So bone spurs aren't degeneration.
Okay, say that once again. That was really interesting. The person has not lost height.
What happens is when you look at the way the spine is, so, talking about the surgeon that came in, his discs were compressed. And knowing that the disc separates the vertebrae or the bones of the spine, if the disc gets compressed, the joint becomes unstable.
Okay.
And so the body, realizing that joint's unstable, lays down extra bone to stabilize the joint. And on an x-ray, it'll look like a bone spur or some type of bony distortion.
Really?
That's not degeneration. It's called degeneration. It's called degenerative disc disease. It's called osteoarthritis. But it's not. It's the body adapting to an unstable situation. So knowing that the disc is alive, you can regenerate the disc, realign the disc, restore the nerve supply and blood supply, change the force loading on the disc so the disc regenerates, then the bone spurs aren't needed and they go away. I know.
That's amazing.
Isn't it so cool?
It is just amazing because people look at bone spurs and they think, I got to deal with it.
Oh my God. When you take a post x-ray and see the bone spurs start to be eliminated in somebody 60, 70, 80 years old, you see the eyes of a child come in alive in them. It's like, oh my gosh, I'm no longer on the way down. It means my body can be young and healthy again, and that's true.
Wow.
So hence the arthritis reversal system, so we can explain it to people.
So you had a ton of experience working with people and questions and all this stuff, so that's when you just said, hey, let me put this all into a system, a website. People can sign up and get access to?
Yep. They can sign up, get access to, and it comes with a series of videos, 4 books, everything. And figure about 25 years ago, I was hit by a car. And I fractured both my knees, my sternum, my skull, front teeth knocked out, a few organs bruised.
Were you in a car or you hit your body?
I was jaywalking, and yes, my kids told me, Dad, didn't you look both ways? Okay, I know. Okay, but the medical world, they kept me alive, thank God.
Yeah.
And the reason the medical world is so efficient at emergency medicine, the best in the world,
yeah, they are,
is because they don't try and cover up symptoms. They fix what's wrong. That's it.
Okay.
There's no question. They look at what's wrong. They fix it. Okay. Whereas in healthcare, there's no question of why. They're just trying to cover up symptoms or alter physiology with a chemical. And so, since I was curious, the medical world was telling me that, the cartilage in my knees, eventually I'll get knee replacements, and eventually,
really?
and it's like, gosh, I was only 30 years old.
Yeah.
I didn't want knee replacements when I was 40.
Yeah, that's crazy.
And the chiropractor I was going to at the time, he said, no, your body regenerates. And so I ended up going to chiropractic college and teaching anatomy, and I dissected hundreds and hundreds of knees because that was my big issue. And I found out that they can regenerate. They're made of living tissue. So I regenerated my own cartilage, and it's like, well, everybody can do it. We're all the same family.
Did you tear ligaments in your knees?
Tore ligaments, fractured the bone, and injured the meniscus. And meniscus can regenerate.
I've heard that, yeah.
Well, what's interesting, and this is where the medical world is off. You have to have an appreciation for how the human being is constructed. Mm-hmm. If you look at the meniscus, which is it's almost like a Tupperware covering that guides the top bone called the femur on this flat plate called the tibia. Now, since there's so much pressure on the middle of that meniscus, if there were any blood vessels in there, it would be crushed. So when you dissect it, you're looking, there's no blood vessels.
Right.
But it's avascular. That means it doesn't have blood vessels, but it's not acellular. It has cells.
Okay.
And those cells are alive. So they get their nutrients through a superfiltrated blood called synovial fluid, which is always being filtered in and always being filtered away.
Okay.
This is why people with toxic blood have poor joint problems or poor joint function.
Really?
It's like diabetes. Diabetes is a poisoning of the blood. Okay, so the blood gets thick and toxic. It can't filter out through those filtration systems to produce that super beautiful lubricant called synovial fluid. And so the joints begin to desiccate, dry up. And
then you
lose
get
their
the
integrity.
bone-on-bone things.
I hear a lot of bone-on-bone, but I rarely see it.
Oh, really?
And a lot of people will be misdiagnosed with this. And I cover this in the arthritis system in a couple of our books, because when you see an X-ray, you're looking at a shadow impression of a bone. Okay, and if the person can bend, say take knees, if they are sitting in a chair and they walked into the room and they said, "Yeah, my doctor said it's bone on bone," I'll say, "I know it's not. If it was bone on bone, it wouldn't bend. It'd be fused."
Of course.
Okay, of course, I know. And so what's wild is I'll take these people, and in order to change their mindset, because you got to change their brain's potential or their brain's awareness of the body's potential for recovery before you can even start.
Yeah.
Right.
So I'll sit them on a bench where their legs are dangling. I'll put some weights on their ankles, and I'll have them just dangle, not swing, just dangle with the weight on. So what does that do? Creates a negative pressure in the knee. Allowing less pressure in the knee is going to allow an increase of synovial production. It's going to strain the ligaments, which if you strain the ligaments, the body regenerates. And I'll have them do that for about 5 minutes. And universally, I've never seen someone walk after, with knee problems, walk after 5 minutes of doing that weight swinging exercise, say that their knee still hurt. They walk around and they have the surprised look on their face and they say, "Oh my gosh, I do notice less pain in my knees."
Wow.
And these are 100% universal people that were told bone on bone.
Isn't that wild?
But then I tell them, I say, it's just a parlor trick. This is only temporary. We've got to figure out why the knee deteriorated in the first place. Knee problems are not a problem of the knee. They're not. Can't be. It's impossible. Unless you're laying in bed and your sweetheart comes in and beats you with a baseball bat in the knee.
That happened last night. I bounced back pretty quick.
Well,
you're very quick.
It's page 69 of the Kama Sutra. No baseball bat.
I wasn't going to say it.
So when you look at it, there's so many dynamics with the knee. It could be the nerve supply. It could be poor kidney filtration, poor nutrition,
circulation.
There's a pump on the bottom of the knee called the soleus. It's inside of the calf muscle. It could be altered mechanics of the foot. It could be a low back or a pelvic issue. You got to solve the source of it.
Yeah.
And then once you restore that, you cause inflammation. Wait, did I say cause inflammation?
Yes.
Yes, I know. You cause inflammation at the joint, and that's how the body regenerates itself. It's the total opposite, because the two types of inflammation that occur: systemic inflammation, which means the entire system's inflamed, which is going to kill you. Okay, and that's from a toxic assault, typically poisonous food or vaccines.
Or it could be stress or any kind of things, right?
Well,
all kinds of stuff.
There's going to be stress is going to cause different. Okay, that's going to cause a stress response, which means that your body's being prepared for fight or flight.
Okay.
So a toxic assault, okay, which is going to be some type of damage to the tissue. And this is what I mean by systemic inflammation, because the entire system starts to inflame, because it's only because little tissue is being damaged.
Yeah.
And if anytime you break a cell, and you could do this like when you scratch your cell, you're breaking a cell and that releases histamines, and the histamines instantly turn it red. And the redness is all the little capillaries, and that's the smallest. That's where like one cell gets down to one cell to do the oxygen and carbon dioxide transfer. That once those histamines are released, all the capillaries start to dilate and open up, and that allows the white cells to go through the capillaries to start healing the tissue. So now you could have that on a cut, But if you have that histamine response going from everything because you're exposed to genetically modified foods or you've got some type of poisonous assault.
Yeah. Probably alcohol too, I'm sure.
That's going to kill you. Okay?
Because this is a low-level systemic inflammation that eventually...
It will kill you.
Brings it down, yeah.
Yeah, and that's it's like the death of 1,000 cuts. Okay, the old torture.
Yeah.
You can solve 1 or 2 cuts, and you can solve maybe 500 cuts. But once you hit 1,000 cuts, you've passed your body's ability to heal, and you'll not make it.
What is that? I never heard that before.
I hadn't either.
Is that how they used to torture people?
Oh, there's so many brilliant tortures. Okay,
so I know, right?
Yeah,
it's like only humans.
One of them is vaccinations. Okay, the other, but that one's profitable.
Yeah, that one makes too much money.
Yeah, it was called the death of 1,000 cuts, where you would do small cuts throughout the body
on somebody. Wow.
Yeah, and eventually you reach the threshold of where someone can't heal. They have too much histamine response. Their body can't regenerate the tissue, and they don't survive.
Wow,
I've never heard that before.
That's interesting. So it makes sense. I mean, if you're just overburdening, and so a systemic inflammation would be almost similar, but something that lasts for a lifetime, which cuts your life short eventually.
Yeah, and when you look at it, how does the body going to respond to a systemic assault of inflammation? It's going to produce the best anti-inflammatory known. It's called cortisol. Oh, and your adrenals crank this stuff out at the first sign of inflammation. Oh, it's just brilliant.
Yeah.
So, but it needs to make the cortisol. It doesn't have it stored.
So the adrenals do that.
The adrenals make the cortisol in order to solve the inflammation.
Okay.
So, but they need the raw materials. So the body builds cortisol out of cholesterol. So it calls over to the liver, which is where 80% of your overall cholesterol is from, and it orders up a bunch of cholesterol.
Okay.
So you get these people that are surviving on, Denny's for breakfast, and then, you get the chicken salad for lunch, and then you get, with the genetically modified
chicken,
soy and something
nuggets.
Yeah. So this is foreign proteins and tissue damaging stuff that you're taking in your system. So they survive, but the blood isn't going to be healthy. So in order to adapt to that systemic inflammation, blood pressure needs to increase. And of course, since their blood pressure is high, their cholesterol is also going to be high in order to produce the more cortisol. So how many people out there are misdiagnosed with high cholesterol and high blood pressure when they really have some type of an inflammatory response?
Yeah, wow. I would imagine, what would you say?
I would imagine in almost every case.
Almost every case.
Yeah. So far, 100% I've seen.
Really?
Yeah.
Because you can always find the real cause and the real answer somewhere else.
Buddy, I've had Vietnam vets that were shot in both kidneys, and they were still able to regulate blood pressure.
Wow.
So, the body's self-regulating and self-healing.
Because when you damage an organ or you take an organ out, you know how they do that with different gallbladders and things. I've heard that the body's somewhat like a hologram where even though other organs, that's not their function, but when they all pool together, they can actually do the job of a gallbladder that's no longer there?
Yes.
Is that true?
Absolutely. There's
crazy.
There's so many. Well, the gallbladder itself stores and concentrates bile, and when that's missing, your liver still is going to produce the bile, and it can eventually irritate the area where the gallbladder used to drain.
Okay.
But if you remove one adrenal gland, the other one doubles its work. If you remove one ovary, the other one doubles its work. If you remove one kidney, the other one doubles its work.
Really?
Oh God, it's so beautiful. We're even finding out now that the brain produces its own insulin.
The brain produces its own insulin.
And this is brand new research that is like goosebump stuff to me.
Oh.
I live for research.
Oh.
They used to think that the brain couldn't produce new cells. That your brain had a limited number of cells, and after college, whichever ones you destroyed, they're going to slowly die off. But it can develop an infinite number of connections. But that's not true. We now know that the brain can regenerate cells, which makes sense, doesn't it? Why would the body have any area that can't regenerate?
Well, I've heard that with my knee. People say, because I have a torn ACL, and people say, the ACL won't regenerate itself.
They say other things can, but that won't. But it seems like the only reason that maybe something wouldn't is if it's blocked.
It's blocked. Okay, and even that, you got to restore the nerve supply. You got to have the healthy blood supply. You have to have the pump on the bottom of the knee working. And as long as you have a couple of fibers of that ACL connected,
which I do,
it's going to regenerate. It has to.
Wow.
You just have to strain it in an appropriate fashion.
Wow. So
it almost seems like what's happened to you, actually.
Yeah, because I had some prolotherapy shots. I had a series of about 8 of them. And I feel like it's really helped a lot.
And think of what the prolotherapy does. It irritates the tissue. If you irritate the tissue, what happens?
It stimulates.
Inflammation. I know, isn't that cool?
I love being a human. You're right.
I know. It's like we could adapt.
Wow.
It's just now we're looking at adaptation to stressful, toxic environment has pathology, and it's not. That's why when you look at fibromyalgia or high blood pressure or arthritis, typically that's just adapting to a toxic, deficient environment.
Okay. So your body, in order to deal with whatever stresses or whatever inflammation you have in your life, your body sets up these systems in order to, I guess, survive? Because that's kind of a weird thing, right?
That's it. That's keeps going back to the same thing. If you're diagnosed with an illness or you have some type of degenerative condition, why? You answer that question, why, and you go after the source, not the symptoms, then your body recovers.
Wow.
And it's a whole different world.
It's completely. You know what's funny is with that, it seems like if the medical industry were to ask that question, which they don't, because there's probably lots of natural things that work better, but it seems like even from their kind of corrupt mindset, if they went down the why road, they could develop medications and more drugs and make more money. You know, even still, it seems like they could do that, which is weird. It seems like they don't even go down that road; they just stick with the.
Well, they tried to.
Did they?
Yeah, and it was called the Human Genome Project, and it was sponsored by the drug companies because, and this is the weird thing, they were running out of sick people.
Really?
And because you only have a limited market if you're marketing to sick people. However, if you can identify the gene that causes cancer or the gene that causes depression or the gene that causes obesity, then you could ask the person the family history. Did your uncle have diabetes or cancer or, obesity? Then you could prescribe a drug before you have that illness.
Right. So why did that fail then?
Because they found out that, the body produces about 150,000 proteins. And they figured one gene per protein. So the human body should have about 150,000 genes. Okay, now you got to do the homework. Turns out that we got about like 23,000, 24,000 proteins or genes. So it's not the way they thought.
So it's not matching up with the amount of proteins.
One gene doesn't produce one protein.
Okay.
And then it's even worse than that. There's a thing called epigenetic control, where there's a control above the genes. So you can have the cancer gene and not express it.
Right.
Okay, you can have the gene for rheumatoid arthritis or for like HLA-B27 for scleroderma or ankylosing spondylitis or all of these diseases that have partly a genetic component but not express it. So there's an epigenetic component, and the Epigenome Project, or the control above the genes that control human genome expression, started in 2003.
So did that kind of have an effect on the outcome of the previous project where they were testing the human genome? Did that kind of like erase what they were doing? You
mean if you invest hundreds of billions of dollars in 20 years and find out that it was like a dope?
Yeah.
No, they're still trying to market that.
Yeah.
That's why you're seeing like all these cancer centers saying, yes, we do gene therapy now to find out if you have this gene, so it's more targeted gene therapy. And that's totally ridiculous because they're still on that same mindset trying to market an incorrect idea, a concept.
Well, they're invested in it now, right? I mean,
totally.
Yeah.
Oh, it's like the infrastructure for vaccines. Or the infrastructure for fibromyalgia or high blood pressure or all of those things.
Because these things are hundreds of millions of dollars or billions of dollars in terms of industry in and of themselves. The cancer industry is huge. I mean,
huge. The one thing that blew me away, it's almost 3 times what cancer is dementia.
Really?
3 times what cancer is?
Yeah. The cost of dementia at Alzheimer's and the related, that's absolutely going to wipe out the healthcare system that we currently have because we can't support it. So, I mean, it's huge. Wow. But then you look at what alters brain function. If you have inflammation, your body's going to adapt, by elevating blood pressure, cholesterol. What is just about everybody over 50 on? Blood pressure and cholesterol drugs. So you're decreasing their adaptive response to a toxic environment. And,
and throw heavy metals in there, you got a perfect chemical soup.
Yeah, exactly, right?
Wow. I know, but it's kind of exciting because when you realize this, that we're not destined to be sick and diseased.
Yeah, that's a huge thing.
By God, I want to be healthy when I die.
Yeah.
And that's what we're destined to be. As long as we change the paradigm, do that paradigm shift of asking why.
Asking why. But you almost have to ask why to yourself because a medical doctor is not going to know why. And he's going to tell you, we don't know why, but I can give you these drugs. So it's almost like you have to ask why to yourself.
Or the right people on your team that actually help you dig and delve deeper into what the real source of it is, which is very few and far between, but I'm glad people are waking up.
Eventually, this is going to be normal. Okay,
you think so?
It's I mean, because what are they? The stages of new ideas. Okay, not accepted, ridiculed, violently opposed, and then accepted as fact.
Yeah, no, you're right.
Yeah, we actually do revolve around the sun. Okay, that was a concept that people were burned at the stake for.
Yeah.
They say in Europe the first ship that would sail against the wind, he thought he made a deal with the devil and they burned him at the stake.
Wow.
So this is a concept of the body being intelligent and there being a control of expressing the gene.
That is just so. This idea of epigenetics, we talked with Bruce Lipton a while back, and it's a really fascinating idea, and it seems to be very true. How long do you think it'll take the medical mainstream science to recognize this?
Currently they're doing it.
Are they?
Yeah, there's so many studies out that are extremely exciting in the epigenetic field, where you're seeing thought processes, and then also to vibrational medicine, where a certain thought can actually change DNA structure, DNA expression, bacteria function.
Really?
Okay. And this is in the scientific journals now. And they even talk about endogenous pharmacotherapy, which means the pharmacy inside of your body stimulating that to produce the necessary drugs. Because you produce the best pain reliever, you produce the best anti-inflammatory, you produce hormones in the exact right amount at the right dosage at the right time.
So you can stimulate that.
Yep.
And have your own body do the work for you.
Absolutely. This is it's in awesome. The research scientific journals now. It takes 25 years for that to be in the medical schools.
Oh, is that right?
Yeah. Any idea or concept now. It took, I think it was 20 years for penicillin to be used.
Huh.
Really? So it's is that just kind of like a set amount of time, or typically that's kind of how it works?
It's almost about a set amount of time, because you need a generation of doctors to either die off for an idea, a concept to be introduced.
Okay. And
hopefully with the absolute failure of the medical system, with 50% of the children having a chronic illness or diagnosis, hopefully people won't stand for that anymore. And taking your 11-year-old to the therapist and drugging your 7-year-old is not normal. Okay?
Yeah.
And that's something in this generation that eventually parents are going to wake up and think, hey, that's probably not good.
Yeah, that's...
It's ironic. It can take 25 years to reach a system, but, the FDA, something only has to be proven for 6 months before they pass it or whatever.
Oh, for a drug, you mean?
Yeah.
Yeah.
I don't understand. That's just, it's asinine.
Yeah, they're not protecting us. And but that's the exciting thing.
Yeah.
Right now, if you're a real scientist, a real researcher, you continually keep questioning yourself on the therapies and the how. It's like any psychiatrist that passes out an antidepressant, Prozac, Depakote, Wellbutrin, Elavil. The commercials say they're called selective serotonin reuptake inhibitors, which means probably, maybe, we're not quite sure, they might do something with serotonin. When you look at the clinical pharmacology of it, though, it says mechanism of action is unknown. Okay, so they don't know how it works. So even those studies with the FDA approving it after 6 months to 9 months to God knows what, it's not accurate. Like, do you know how Tylenol works? The number one drug prescribed in America.
Is that right?
They don't know how it works.
So that's written in their journal?
It's
in the
there's a really cool and this is
crazy.
Oh, it's not just that. There's a really cool website called rxlist.com. rxlist.com, and you go in there, and of course, if you are taking drugs, this is going to be like a horror story. You type in anything you want in there, and it'll tell you over like 15 pages of what it is, what its contraindications, what it does, how dangerous it is, what its effects are. I don't want to say side effects, but it'll list side effects.
That's what you always say.
What its effects are.
Yeah.
And then you'll find, like on page 8 or 9 typically, the clinical pharmacology, which is how it actually works in the body. And if you look up Tylenol, it says mechanism of action remains elusive.
Really? Remains elusive.
I know it's the deadliest drug in America, leading cause of liver disease, and here it is, Tylenol.
Wow.
And when you and it's such an eye opener.
That is amazing.
When you look at it, we can see how it works sometimes. My nephew, he just graduated from Johns Hopkins. Brilliant guy. Is into research. And at one of the finest schools in the country, his professors were saying, we know what the chemical structure of a drug is. It's like the old magic box in the theater. You put it in the human body, something happens, and then you get an effect. And you write down all the different effects of the drug. They don't know how it works. Figure, they used to call medicines patent medicine because it had to be something unique in the world, not found in nature. And all drugs do one of two things. They either block a receptor site on a cell or poison an enzyme.
Okay.
You can't do that. It's like Doan's pills doesn't just go to the back. That antacid doesn't just negatively affect the acid secretions of the stomach. It's a massive... If you're stopping one enzymatic reaction in the body... It's a cascade of other things, right? I have no friggin' clue at what it does. And that's why when you look at the effects of there, it's huge. Wow. This gal I spoke to this morning from Brazil, 11 different medications. That's what
she's currently taking.
That she's currently on. The record I've ever seen in my office is 32 prescriptions.
No.
32 active. Oh, my God.
How's that person walking?
Or
driving.
With pain or difficulty. And I tell them,
my gosh.
Because you hardly know what one does. Most people don't know what one drug does. And,
they don't know.
And even when you look at 10 people sitting in a room, if you give them each a drug that you absolutely know how it works, are they all going to react the same?
Yeah, they could all react in 11 different ways, right?
Even you take the same person, have them stay up all night and take the drug, or have them sleep all night, or have an inflammatory meal the day before, or have them emotionally upset. They're going to metabolize the drug completely different.
Yeah, or take it with a glass of wine. I mean, you're going to have a bunch of different effects.
With food or without.
Yeah.
The entire concept of altering physiology with a chemical, it's illogical for a long-term outcome. For short-term, oh my gosh, when I had my legs broken, color me there when they offered me morphine.
I bet.
I'm like, this felt wonderful.
Yeah.
Okay.
Oh, yeah.
Yeah, but you can't do morphine for very long because it's going to negatively affect lung function and liver function. But I get people stoned on opiates all the time.
That is so amazing. Was it your lecture that at the Living Temple that we I think you said this. If it wasn't you, it was somebody else. But they said that when you get to, I think, over 3 medications that somebody's on, you get to some some type of mathematical equation that's 10 to the whatever power, where there's a mathematical impossibility for anyone to understand how they react to each other and then how those react to the body. Is that you?
It's absolute.
Okay.
That's absolutely true. Because if you have what it is, it's an exponential ratio. Let's say, in theory, that you have one drug with 3 known effects. Okay, and that drug doesn't exist, by the way. But let's just
so only 3
for simple math circumstances.
Okay.
One drug with 3. You couple that with another drug, a different drug with also 3 effects. Okay, how many effects is that? It's 3 times 3 times 3, or 27 effects. Let's say you couple
it's like
that.
The Richter scale.
Yeah, it's 3 to the 3rd power, so it's not 3 times 3. And then you couple that with another drug, and we're talking not even that the chemicals are going to start to interact. We're just looking on a piece of paper at the generic person, which doesn't exist because we all metabolize the drug differently,
right?
On side effects that we still don't know if they're going to work, and mix it together. It's insanity.
It's insane
to think that you're going to have a long-term effect on a body, since it's the drugs only are going to block a receptor site in a cell or poison an enzyme. The body, like you said earlier, is adaptive. If you decrease an enzymatic response or you continually block a receptor site on a cell, the body's going to adapt over weeks or months or years of taking this. And so what's that adaptation going to present like?
Yeah, I wonder, and I suspect that if someone's on a medication like that for many, many years, it's got to express gene expression. It's got to change and alter how genetic code is manipulated and expresses itself.
That's actually in the medical journals.
Is it?
I have that in about 4 of our talks where they talk about epigenetic effect of the medications. And the medications that they currently list that have epigenetic effects that can control gene expression, guess what they are? Blood pressure drugs, cholesterol drugs, antidepressant drugs, antacids, antihistamines. All of these have epigenetic effects where they're actually controlling gene expression.
So this is a conversation I was having last night with a couple of friends. I wonder if it's possible, I think that it is, that people's genetic, when they pass on genes to the next generation, to their kids, I use the example of someone like Arnold Schwarzenegger, who was, if he had never went into a gym his whole life, he probably looked like a regular 6'3" guy or whatever he is. But because he did that, I suspect that because of something like epigenetics, that his son or children would somehow have either the ability to be stronger or they just were stronger because of what he did to his body before he had children.
Oh, absolutely.
So that kind of, what do they call that? It's not a gene because
it's well, there's like 3 different ways that we pass on information to our offspring. Okay, genetics is one, and genetics are adaptive. So we're creating a different gene human that the world's never seen.
Okay.
We also have viruses that affect our genome. And the viruses aren't like pathogenic viruses. They're actually, viruses are well-organized molecular parasites designed to give our information. They say, some estimates I've seen are as much as 70% of our DNA is viral.
Wow.
Okay, so the viruses are actually communicating what our system needs.
Is it true that viruses aren't alive, or
they're not alive? They're
okay.
It depends on your definition of life. If your definition of life is that they reproduce on their own, okay, then it's not.
Okay.
Because they need host DNA in order to reproduce, or host RNA if they're a retrovirus. So they need a host cell, a living host cell, in order to reproduce themselves.
Okay.
And of course, don't go down that road, because if you start thinking that, well, does that mean that everybody that gets a virus is going to have a different expression of it, because for that virus to reproduce in you has to use your DNA, and if it's going to produce it's going to be so
that's a rabbit hole there.
Yeah, because then you're going to think, well, vaccines are kind of dumb to begin with.
Yeah.
Okay, so
kind of shoots a hole in that whole thing.
Yeah, but so when you start looking at how that system works, okay, passing on your environmental adaptations, absolutely it does. Environmental adaptations. If we hung out for 50 years in the north, our eyes would eventually become lighter. If we hang out 50 years around the equator, our skin over 50 years is 2.5 generations. We're going to have darker skin. More melanin in the skin, more adaptation of the sun.
So that is definitely a part of the epigenetic gene expression.
That
happens. So it's pretty cool, because we talk about a lot recently. I think that people don't look at their genes as something that's like a gift that's sort of handed down to you energetically from someone to where we're all given this sort of present. And how are we going to pass on? Because we're talking recently about this, about how many pregnant women will basically, cut out alcohol during pregnancy and things like that.
3 months before, thinking they're preparing, for...
Yeah,
it's just crazy.
But we're not realizing that our genes, how we live our life when we're 15, 20, 25, 30 years old, all play into...
all leading up to that.
Child.
I love the way you said that. The way you worded that is brilliant. An energetic gift. The genes are an energetic gift from your ancestor. God, that's cool. That's goosebump stuff.
You said that the other day, and that gave me goosebumps too. I was like, wow. It's very illuminating.
I don't know who gives it to us. That's another show. But I mean, it is kind of like that, right?
Well, it is true. You got to... The way that healing is occurring, okay, it has to do with how structures reproduce, okay, and how they produce depending on environmental stimulus. And they used to think that there's certain tonal vibrations, like thought has an energy behind it. And this is where Bruce Lipton's work came in a lot. Also, Joe Dispenza's work comes in a lot.
We're having him on pretty soon now.
Oh, it's a brilliant guy.
I can't wait to talk to him.
Smart guy, yeah.
He's awesome.
And they talk about, I'm just reading his book now called You Are the Placebo. It's brilliant because your thought, I can give you a pill and say, look, this is a sugar pill, but it causes pain relief. Okay. You would produce pain relievers in your blood. We could measure it. This is a sugar pill, but it's so you know that it's a placebo.
So you would even tell the person?
You could tell the person it's a placebo, and it still works. Really? There was a study on rats where if you injected a rat with a cancer that has 100% mortality between 14 and 28 days, and you would this one doctor would hold the rat cage for an hour a day and focus positive intentions on the rat's healed. And so then they thought, well, maybe he's just cool or special or knowing. They got a group of college students, and they told them, this is a test for gullibility. We want you to hold the rat, okay? And you're supposed to focus positive intentions, but I just want you to hold the rat. Their rats recovered as well.
Really?
So why?
Yeah, what is going on there?
I know. This is the exciting part that the real science is going towards. It's not only that, like you mentioned before, that the thought process or the mind has to change first, but once you realize your perception of your potential, and that's what we start with. When I get these patients in with whatever, high blood pressure, cancer, dementia, all of those different fibromyalgia, everyone that comes in, you've got to make them aware that the potential is 100% recovery. Okay, but they've got to think it first. And then their thought process is going to control genetic expression. Then you work up all the other stuff.
All the physical stuff.
Yeah,
and then
you get the nerve supply working, you get everything else working.
I would imagine that would be the hardest thing for people, because people could come to you and see that you could do some really amazing things and teach them some things and help them heal their body. But I would imagine that would be one of the hardest things for people to change their perception. Can I really heal? Because then you're getting into a whole lifetime of, people having these negative thoughts about themselves and patterns and things.
That's why I don't tell them the first visit. Yeah, very, very few. I'm talking less than 2% of the population I can talk to like that.
Oh, really?
The first visit, I go in and I say, facts. The nervous system controls and coordinates every function of the body. I take an x-ray. I show them where the nervous system is choked off, where there's misalignments. I explain brain function. Okay, and then a week goes by, I talk about nutrition and detoxing their system from medications they're currently on.
So you're kind of sort of easing them into that.
Then we talk about mental focus,
Wow.
deep sleep, tissue regeneration, how your thoughts control that genetic expression. So you get, I mean, that horse has got to pull the cart.
Yeah, that's true.
You got to break it down to take people that are in a mindset of disease as existing as opposed to health as a natural state, and every symptom that their body's expressing is the result of environmental stimulus.
Yeah. So getting people to believe that they're not diseased, but their health is just a little bit lower. So you're still focusing on health.
Yep.
Instead of disease.
the attack.
Well, there's a study that I heard this a while back. It was something to do with these mice, and they talking about genetic expression and what you pass to your children. They had these mouse or mice, and they would expose them to like a citrus kind of a smell. And at the time that they exposed them to that smell, have you heard about this?
Yeah.
And at the time they were exposed to that smell, they would also shock them or something, do something to their nervous system and send them shock waves. And then, tell me if I'm explaining this correctly, but the mouse's offspring were only exposed to the citrus smell, and when they exuded some sort of
stress response.
A stress response, right?
Is that how a generation removed. I mean,
and they were never exposed to the shock, the second generation, which is amazing.
What the heck?
Oh, it's fantastic.
Like, how is that? It's like a memory that gets passed down through the physical genes, or maybe through our energetic body. I don't know what's going on.
When the real science starts happening again, and it's happening in some circles, that's going to be that's going to be answered. It's like, so? Why does a sheepdog already know how to herd sheep when they're puppies?
Yeah,
where does that come from? You know, it's
never haven't been taught.
We know
you're right.
There's so many things that are coming in that are beyond our current understanding.
This is something Kate and I talk about all the time. It's my contention that humans on the earth know probably less than 1% of what's really going on. What do you, for all that we do know, which is amazing, especially with guys like Bruce Lipton and your work and Dr. Joe Dispenza, these type of people, with all that we do know, how much do you think we really know about what's going on with the human body?
Oh, almost nothing. It's more energy based than chemical based, and thought we know now in certain individuals that can control it can control everything. They can control disease expression or suppression. They can regenerate virtually anything. There's no limits to what the body can recover from. I mean, I've seen it in my practice. I've seen every incurable disease better.
Wow.
And it's even though they've had it for weeks, months, years, decades, it doesn't matter. Once you change the awareness of the person's potential, then you look at diseases not as pathogenic or a problem, that the diseases are an intelligent representation of what the body is viewing.
So it's like putting on a jacket when you go out into the cold. It's like the body's just adapting to some problem. So the problem isn't the jacket that you have on. The problem is it's just too cold out.
Absolutely. That's where the rheumatoid arthritis comes in. That's where the fibromyalgia. That's where the cancerous tumors.
Wow.
And this one patient came to me, this was 5-6 years ago, with a 3-month-old fetus and a tumor the size of a grapefruit. And they gave her 2 choices, kill the kid and we'll take the tumor, or if we take the tumor, the kid's going to be born deformed.
So this was like a cancerous tumor, or just a
fibroid?
A huge fibroid,
okay.
And rapidly growing.
Okay.
And so at the time I had a diagnostic ultrasound, and we adjusted the area that I know of, the kidneys and pancreas, that helps with tumor growth, got her nervous system working correctly, And we monitored it over the next 3 months. The tumor kept getting smaller and the kid kept getting bigger. And sure enough, when the kid came out, no tumor.
Wow. And the fibroid that was
it was gone. Just disappeared.
I was going to say smaller, but it was gone.
Gone. Yeah.
Wow.
Yeah, you figure if the body's going to lay down tissue, it can tear it up. You've got cells in your system called macrophages or big eaters that are designed to chew up abnormally placed proteins. And so you stimulate macrophage activity, or the normal, and that's a normal immune system function, is to chew up stuff that shouldn't be there.
Right.
And so it's like a bruise. You stimulate macrophage activity.
Your body wants to heal.
Yeah, so why not tell those guys to start eating up cancerous tumors? Once they recognize a cancerous tumor as pathogenic, it goes away. The challenge is changing the immune system to recognize that has not self, and then it goes away. That's the future of disease reversal.
Wow, because that's what we're doing too when we're approaching a disease. Is we're focusing on the energetics of it, the nutrition. Because when you're taking in nutrition, it's really just information, right? It's electrical, chemical, as long as it's, I guess, living foods, but it's really carrying electrical potential and information and all that.
Oh gosh, yeah. You look at all. I mean, just look at, and I'm talking about plant-based foods. You look at the different colors and shapes and textures, and I mean, those are the phytonutrients that plant's needed to develop to survive its assault of viruses, bacteria, funguses. You look at root vegetables; those suckers grow on the ground where mold and funguses are attacking it.
Yeah.
So those molds and funguses, those antifungal, anti-mold properties, are in that genetic memory of that plant. So you juice some carrot juice or beet juice, you actually have that antifungal properties put back in your system.
Wow.
You juice those or eat the blueberries. You're having all of the genetic intelligence of that plant that it's survived in its environment with exposure to viruses, funguses, and bacteria. You're taking that memory into your system so your cells can adapt. And then that's why when you look at this and you think, well, yeah, one serving of plant products a day help with high blood pressure. No, it doesn't. It helps with cell regeneration.
Yeah, which helps that.
Yeah. You're getting, it's like a gift. It's like, oh my gosh, it's right here in the plants.
Wow.
That's amazing. Wow. It's just so fascinating to me how connected the human body is. And approaching a disease like arthritis or fibromyalgia or these types of things on a lot of different levels, I think is the way it's going to have to go. Because, like you said, people that are going to be throwing drugs at their disease and getting all these effects of those drugs, I think eventually people are going to wake up, they're going to get sick, and then they're going to wake up and figure either the kids, because this is what happened with me. My mom had cancer when I was, I forget, it was 1995, and she had non-Hodgkin's lymphoma. And she went through chemotherapy, radiation, surgery, bone marrow transplant. She's still alive, and she's thriving. She's doing really well. But she made it through all that. She stayed at the City of Hope for, I think, 2 different times for over 30 days to do the bone marrow transplant.
Wow.
Amazing.
That woman has more will. I think her will is what kept her.
Oh, my goodness.
That's incredible.
So I watched her go through that, and I thought, this is just absolutely crazy. And so sometimes the best teacher are negative things that happen to other people.
Oh, it is. There is no negative or positive.
Yeah.
There isn't. This right now, this insanity that we're going through is such a brilliant education to wake up the mind of the potential. I did a talk at a couple of high schools, and I asked my high school patients, what do you want to hear? What do you want to learn about? Because I really didn't know what a 16, 17-year-old kid was. Yeah. I'm thinking girls and cars.
Yeah.
And
beer.
You know what they wanted? They wanted to know about diabetes, high blood pressure, and cancer.
Did they really?
And it was a total pattern interrupt for my brain, because it figured, what are their parents going through? What are their relatives going through? What's their uncle got? What's the fear factor? What are they seeing on TV, on the TV shows, on the advertisements?
Wow.
And it just blew me away. And so to talk to these young kids about genetic expression, that you're not a slave to your genes, okay, that your body is designed for health, that these diseases don't exist. They got it.
Were you in a public school when you're doing this?
Oh, yeah. I taught.
They let you do that?
They let me do it at 2 schools in San Pedro, 1 school in Riverside, 1 school up in L.A.
Wow. Do they still let you do it?
I have
a talk like that.
I have been invited back, okay, multiple times. And
you have been or have not been?
Haven't.
Okay.
Haven't. I did 2 talks in San Pedro and 2 talks in Riverside.
That's amazing.
But I'd do it in a second, because if you can change these kids' potential, they're the key to changing the next generation.
Absolutely.
To getting them to question.
And these kids that are growing up now, I was talking about this with a couple friends last night. I mean, it's just, these kids are growing, if they're 16, I mean, they're born in 99 or 2000 or 98. I mean, they haven't existed in a world without the internet. And so these kids, either they're going to be completely vaccinated and have real bad problems in terms of all that, but they're also living in a world where they probably are much more awake and aware because of the internet and because of this information they're able to get. You know, it's amazing.
It's really fun.
It's pretty cool to see.
Because remember, there's no negatives that happen. Even though the toxic exposure, the loss of a generation, all the things that are going on, it has to happen in order to get that paradigm shift of thinking into a more energetic world. That the food's got energy, your body's got energy. It never does anything unintelligent.
Well, hopefully one of those kids or 2 or more can look back and one day look back and say, it was that talk with Dr. Bergman that opened my mind.
Oh, God.
You know, wouldn't that be
now
amazing?
They're a front runner in the...
Oh, I would love that.
It's amazing. I mean, you never know who's listening in there. The next president or the next famous doctor or something. The next Dr. Oz, you know, it's like...
Who knows?
A real good friend of mine, his name's Dr. Marcus Mann. We've studied together. He's a chiropractor in, I think it's Ghana.
Oh, really?
And the president of the country and the health minister of the country are both his patients. And they say that chiropractic or, natural health care is the key to getting them up into the 21st century for health.
In Ghana?
Yeah.
Wow.
And it's I mean, I'd love to see that here, but we have to lose the infrastructure first before people look at plants, fruits, vegetables, and their body as intelligent.
Yeah.
And I think that getting the word out is just so key, and waking more people up, and just having people exposed to shows like this or other internet radio shows or your talks at the Living Temple. And I think a lot of your talks are available on YouTube, right?
All on YouTube. We're about 450 talks now.
Jeez.
Oh my goodness, that is so cool.
It's really fun.
And how long are they?
Usually about 30 to 45 minutes.
Okay.
And we always got the handouts. That's why the owner's dash guide site is nice, because they can get the copies of the handouts and the PowerPoints and all the research. Because when you question people's belief systems, you got to have some research to back it up.
Yeah.
And that's how I present all the talks, so that they've got the ammunition to change their parents or ask their doctor questions. To get even the doctors that are prescribing the toxic drugs to question their own protocols.
Wow. Well, when we came to one of your talks at the Living Temple a couple months back, Justin and I both walked out and we go, "Where was Dr. Bergman when we were in high school?" That's what we said. Because we felt like, why wouldn't a guy like this, why couldn't we have somebody like that speak at our school? It would have changed our path so much younger.
Oh my gosh.
Oh my God.
Where were you?
I'll go to any school, anywhere, anytime. Yeah.
So anybody listening, if you want him to come visit your school, send a shout out. No, but seriously, do you remember saying that? We walked in the car and we're like,
I remember that.
This would have made everything real, more fascinating. But instead, we sit in science class and we learn about I mean, all that stuff's important, but it wasn't interesting. It wasn't like you wanted to change your life because of an atom.
I think it's probably because you're given something that's so standard and so archaic. I think when a child listens to that kind of information, I think there's something that happens at their subconscious level where they just know that either it's not true or it's just an archaic thing. I think they just know. I think they look at it and they're bored out of their mind at the first thing, and they just know that this is not something that I care about, because I know it's an old model. Somehow, probably all that actually gets translated to them in such a way where they're just disinterested.
I had a 17-year-old soccer player yesterday that had leg pain and back pain. Came to me after 4 weeks of being on pain relievers, and her medical doctor said it's from a pinched nerve in the back. And so I look at this 17-year-old, and I said, the doctor said you have a pinched nerve. Do you think the drug's going to unpinch it? She smiled, she looked down on the ground, and she says, no, of course not. That's why I'm here. And I thought, because she had to convince her dad to say, Dad, this is dumb therapy.
It's true.
Wow. So the common sense is there.
It is there, isn't it?
It's really, it's
awesome.
I remember the moment that hit me for the first time. It was like 8 years ago, and I said, I have a really bad headache. I'm going to take a Tylenol. And at this point, you were already turned on and said, oh, I wouldn't do that. And I said, why? And you looked at me and you go, because your body isn't lacking Tylenol. That's not what caused your head. And it's like, ding, light bulb. And that was the moment. That was the defining moment. Probably like the 17-year-old yesterday where you go, that doesn't make any sense.
It doesn't make any logical sense.
I'm not lacking Tylenol and that caused me a headache. Like,
you're not deficient in Tylenol.
It's like I was walking around in a fog all those years. I mean, that's how I feel.
Because you're just taught to take, you have this, you take that pill.
Yeah.
It's
you're
so
not lacking these pills or these chemicals.
I think for us, this new generation, I think is really cool because for even in our generation, we would watch the news or we would watch things on TV and commercials and those ibuprofen commercials and Nuprin and all that stuff. And I think in this generation, people aren't watching TV as much. They're watching YouTube clips and online stuff. And so they're not getting as much of those weird commercials where they're taught to just pop pills all the time. Mm-hmm. So I think that expresses itself in your patient where she goes to see you and has to tell her dad that this is screwed up logic that my pill is gonna fix my pinched nerve.
It's really cool.
It's really
this
cool.
is we're on the edge. We're seeing the Renaissance.
Yeah,
and we could turn behind and look at the Dark Ages that some people are still in.
Yeah,
but this is it's very exciting.
Yeah, it's very exciting. Awesome. Oh, no, we're not going to take another break.
Oh, okay.
This is going to be
perfect.
Are you able to go any longer, or do you want to
wrap it up?
Or
I don't know. Do you have anything else you want to? What time is it now?
Yeah, I want to let people know it's about 1:00, and you have to be back by 2.
Yeah. Then I got to take off.
Oh, you got to take off. Okay,
good thing
cool.
we looked.
So the website is the Arthritis Reversal System, and people can go on there and sign up. Right? I think there's a little questionnaire there, right? Okay. And they would go on there and just to let people know, you have a bunch of videos on there walking people through in a series of different modules, right?
Yep. And it's all interactive so that you learn how to change your nutrition, to change the fluid flow to the joint so you get healthy synovial fluid. You learn how to get exercises to strengthen the joints. You learn how to detox. You learn how to change your mindset for tissue regeneration. You learn about medications and how to decrease the need for them.
Wow.
Oh, it's a real complete system.
That is awesome. So people can watch those. Are they available in audio too, or just video?
I think there's audio too.
I think there is. From what I looked at, there's audio too, so people could download that on their iPod or whatever and take it with them.
Wow.
And then we have the owner's dash guide site, which is fun because that's got videos, handouts, flyers, and the research.
That is so cool. Well, and then people can look at all your videos. Are those for free on YouTube?
Yeah.
Right?
Yep. Absolutely. John B. Cairo is the channel.
Okay. We'll put a link to that on this show page. Awesome stuff.
Wow.
Thanks for inviting me.
Oh my
this
God.
was really, really
coming.
fun.
Oh, thanks for
this
coming
great.
down.
Flew by, obviously.
Yeah,
we didn't know how late it was.
An hour and 40 minutes. We didn't even take a second break.
It, honest to goodness, didn't seem that long.
No.
It just flies, doesn't it? I'd love to do any other shows. If you'd love to come in studio, we can talk about different talks you're doing that correlate with the ones you do at the Living Temple or whatever.
Oh, buddy, anytime. You invite me down, I'll be here.
That would be so cool.
Thanks, Dr.
I would love
Bergman.
that. All right. Thank you so much, everybody, for joining us on this episode of Extreme Health Radio. If you guys found this particular episode to be useful, please pass it on to your friends and share the love on Facebook or Twitter, whatever you guys can do to get the word out. We'd appreciate that so much.
And if you're in the Orange County or LA area, please consider coming down to visit Dr. Bergman because I'm going to be doing that soon.
Are you going to be doing any talks at the Living Temple if people want to come and
Oh yeah, this coming Thursday we're talking about diabetes, cause and cure. which 95% of all diabetics are type 2, and that's typically curable in about 30 to 45 days.
Okay. Have you done anything recently with the ALS? Because that whole thing has been going around.
Oh, no, I didn't, but I'll do a talk on that in October.
Yeah, because that is you've seen that ALS challenge.
No. Oh, is that the ice bucket?
Ice bucket challenge. Have you heard about it or seen that?
Oh, it's insanity. Yeah,
I know.
we've got to talk about the cause of ALS.
Yeah.
Okay.
We could do a whole show on ALS.
This would be a really good time to do that because it's so
in the media in your face.
October.
Around.
I'll do an ALS talk.
That's
awesome.
That would be cool. So if you guys are in the Orange County area, make sure to go visit Dr. Bergman at the Living Temple, and you can also visit his website bergmanchiropractic.com if you guys are interested in visiting him in person, or skypepackage.com if people want to work with you over Skype. So that's a good thing.
Awesome.
Well, thank you for being in.
Thanks for inviting me. This was fun.
So great. All right. I hope you guys enjoyed that interview with Dr. John Bergman. Kate and I are going to be right back right after this break. Kate and I have had our sauna for about a year now, I'd say, when we first got it from Phil Wilson. And it's an incredible machine. We use ours about every single day. Kate sits in about 20 minutes, and I sit in there about for a half hour. Usually watch a documentary, and it's extremely relaxing. It's really, really incredible machine. And if you go to extremelehalthradio.com/sauna, you can learn all about it. We did an entire hour interview with Phil Wilson. You can check that out. You can look at the pictures of us with it. You can watch videos on that page. It helps you to sleep really, really well. You can lose a lot of weight with it. You can burn, I think, around 600 calories in about 20 minutes or so. It improves your skin, increases circulation all over the body, and circulation is critical for your health. You can prevent and reverse diseases with it. If you have a cold or flu, it's incredible. It heats you down to the core. It heats 4 to 6 inches inside your body, so it's really incredible. And a lot of people use it for cancer as well. So if you have any kind of incurable, quote, disease, you can use it for that. And Dr. Shade is the foremost authority on detoxification. And listen to what he says about it.
How do I detoxify from plastics? I mean, you guys are using a sauna, and what does a sauna do for us? A sauna is great. It's moving a number of different toxins. Remember, we talked about the mice that if you put PCBs in there, then that made the mercury all that much worse. And sweating moves out a lot of plastics, volatiles, fat-based toxins. It's really good at moving those out, sweating those out. So that's how you're getting those out, and those are contributing to this synergistic soup inside the body. And so that's why they're good, is they're taking out a bunch of the different things in the soup.
And Daniel Vitalis, one of our favorite guests. What do you have to say about the sauna?
When you go into the sauna, like a far infrared sauna like you discussed, your body goes into a deep relaxation mode, and your sympathetic nervous system shuts down and your parasympathetic nervous system turns on. And when that's active, that's the nervous system, part of your nervous system that's active when you meditate. That becomes active, and your detoxification pathways open up wide. Why is this important? It's important because when you go running and you sweat, you're not necessarily eliminating very much toxicity from your body. But when you sweat in the sauna, you eliminate a lot of toxicity from your body. So sweating in a relaxed state is how we eliminate. The other thing is that what's wonderful about the sauna is that it puts you in a parasympathetic nervous system response, like as if you were meditating. So it's almost a hack. It's like a trick to get yourself into a meditative, relaxed state, to decompress stress, to reverse the effects of stress, and to get your body eliminating deep, deep toxicity that's stored in your body fat because it can come out in the oils of your skin. So I think, sauna is one of the most crucial detoxification, really health practices that we could take on, especially in this era of heavy toxicity, particularly fat-soluble toxins.
This sauna is really, really great. They offer payment plans because if you buy it through PayPal, it's 100% secure. You don't even need a PayPal account. I think you could do a payment plan through PayPal. It's got low EMF electromagnetic fields coming off of it. It's portable, so that means you don't have to knock down a wall in your house. You can just move it from room to room. It sets up in about 2 to 5 minutes. It's super easy to clean. All you got to do is wipe it down when you're done and wipe the neck down. And it produces energy and heat inside very, very evenly throughout the whole machine. All you have to do is sit in there for about 15 minutes a day, And the great thing I like about it, too, is it requires zero preheating. So you turn it on, and you're starting to get warm, and you're starting to detoxify with that far infrared light almost immediately. So it's really great. It comes with a 1-year warranty. It's about $990 plus $25 shipping. And that's really, really a good deal, because if you look at most of the regular saunas out there, they are in the $2,000 to $4,000 range. So this is really, really a good deal. So check it out, extremehealthradio.com/sauna.
All free shows, all the time, on Extreme Health Radio. Opening minds and transforming lives worldwide. Join our community today. Sign up to our email list and instantly get our free gift to you, along with loads of inspirational content and cutting-edge tips to help change your life at extremehealthradio.com/subscribe.
All right, so there you go, Mr. Dr. John Bergman. Pretty interesting, amazing guy.
I love that man.
Isn't he awesome?
Oh, he's amazing.
Yeah, we had such a great time with him. We might try to see if we can't get him into the studio
more often.
Yeah.
Yeah.
He's only about 40 minutes away, but just incredible guy.
He is incredible. I remember thinking, seriously, saying when you and we said that to each other when we walked out of his talk at the Living Temple in Huntington Beach.
That.
Yeah. We're like, why couldn't learning have been this cool when we were young?
Yeah.
Younger.
Yeah, totally. I remember that.
It would have roped us in. I mean, it would have affected my life, I think, and had a bigger impact.
Oh, yeah.
Rather than the way that we did school and learned about the body. I mean, we're just so eons behind what was really going on.
I was at a friend's house last night, and his daughter is doing some sort of schooling, and it was like biology or something, and it was I looked at a piece of paper that she had written on, and it said something about the blood vessels carry oxygen through the cardiovascular system through a one-way thing, and all this stuff. Mm-hmm. And it was just like this definition,
Yeah.
And I just thought, boring.
I know.
You know what I mean?
Yawn.
But when you realize there's like genetic potential, genetic expression, true healing from deep diseases like cancer, when you start realizing this kind of stuff, all that stuff is just, it's so archaic. Like I was saying on the show, it's so old.
Yeah. It's an old model.
It's an old model.
It's like it really honestly just doesn't work anymore, because I don't think the body's ever worked that way, but we've all bought into a system.
Weird.
That said this is how it works, 100%. And like he said, nobody really knows what's going on. Like probably 1%.
I know.
Of how things really work.
And it's amazing how much we know, yet how much we need to learn.
Mm-hmm.
I was saying goodbye to him downstairs, and gave him a hug and said thank you so much, and he's like, oh yeah, man, let me know anytime. I just had the best time. That was so much fun. And he smiled and said, we're changing the world, as he was walking away. And I said, oh my gosh, I'm sure we are, And then he pulled out that piece of paper with that patient of the woman in Brazil. And he's like, hopefully people like this will start to change their life,
Wow.
And he held up the piece of paper, and it was just so cool. Like, you can tell he's such a genuine guy.
He is so genuine.
It's so cool.
I love people that what you see is what you get. It's like he was the exact same person presenting us in front of 50 people as he is just hanging out, talking with us.
Yeah.
And I can see why people fly from all over the world and nation to see him.
I think we're going to go see him, aren't we?
Oh, we are.
Yeah.
It's interesting because I've had this thing with my shoulders where they just seem to be like kind of growing forward and rounding.
Uh-huh.
In the last couple of years, I've noticed it a lot more, but it's something that I've been wanting to see if that was something that he could work with me with. And so I thought today I'm going to ask him when he comes in if this is a very chiropractic thing, because it was interesting enough. Yesterday I went back to the gym for the first time in like 2 years, and we can talk about that another day because that was
oh wow,
Maggie just tried to jump up on me and ate it. You don't want your back adjusted.
She wants that food on the table there.
You can't have my food, Maggie. Dr. Bergman's going to have to come back and adjust your C89.
Your C88, Maggie.
But there was a physical therapist there. that we were talking with.
Oh, right.
And we were talking about, our ailments or little minor problems. And I said, what do you think this rounding of my shoulders thing is? That a chiropractic thing? And she said, oh no, that wouldn't do anything. Chiropractic, work couldn't touch that. It's more of like, you need to get this like built-in, what's it called?
Like a shirt.
Like a shirt that helps to bring the shoulders back and correct the muscles from going forward and things.
Right.
And that made sense, but I thought, gosh, it's just Dr. Bergman's a step above just the average person that's in the healthcare industry. He's a holistic practitioner.
Yeah,
he knows quite a bit. And I thought, I bet he's going to say a conflicting opinion. And sure enough, he said, oh my gosh, that's why your neck's floating off your head, or that's why your shoulders are doing this. And that's completely treatable. It's just, and I'm a believer. I'm totally a believer. So I'm going to be going to see him.
It's cool though, because it's as the CEO of our own healthcare, of our own bodies. It's cool because you can take little ideas and principles from different people. Because what she was saying about the musculature and how to build muscles that actually can hold the girdle of the shoulder up more properly and in a better space. I think there's a lot of value to that, and I think that
I do too.
That would be great to do. But I think there's also another step you could go, which is the stuff by Dr. Bergman.
Well, like he was saying, what's the root? What's causing the why? Why is my neck going forward? Why are my shoulders curving in? Like,
oh, right.
Instead of giving somebody she was great, and I'm sure that would help. But instead of saying, hey, wear this thing or buy this garment to help correct you, you have to address the deeper. That could be related to my spleen. I don't know what's causing it,
Yeah, it could be some organ that's not working correctly. It's amazing how interconnected the whole body is. I just loved him. He was such a great energy.
He's a joy. Like that was a big joy for me.
Wasn't that fun?
I felt very honored.
Yeah, just a great guy. We highly recommend seeing him. He's a guy that's going to empower you. I think he's going to give you guys tools, and he's going to talk to you in a way that gives you hope. Because I think that with a lot of doctors, that doesn't happen. They say, oh, you've got this diagnosis, you've got some disease, this is what it's called, this is the label that we put on it, here are the drugs that work for that. But Dr. Bergman's going to get to the why of what's going on, and I think he's really going to be able to help you fix a lot of, or any of your challenges that you have with your body, and give you hope that it can be fixed,
Yeah, I do too. I think it's I don't think that we look at the label or term chiropractors. There's a chiropractor, and then there's a step above, like a whole body healer through the means of chiropractic.
Yeah, because for some people it's their destination, but for other people it's a springboard for a holistic approach to your health. And you can tell guys like him, they're always learning. They're just always learning. He's always doing research, and and with the chiropractic, I mean, that's just a way for him to be able to be a part of the medical party, I guess you could call it, a little dance that they do. But that allows him a little title and stuff like that. But his true work is a lot deeper than that, which is cool.
Wow.
Yeah. Good stuff.
Mind officially blown.
Yeah. So if you guys are interested in checking him out, you can go, like I said, to Bergman Chiropractic. Check out the Arthritis Reversal System, too. He's got, 5 modules in there.
Does he really?
Yeah, I'm looking at it now. And he's got a ton of research that's was part of a tab. And each module has a series of, like Module 5, for example, the nervous system. And then you go to Part 1, and you click into there, and it's got an MP3. He's got a whole PDF download that goes with it, along with a video where he goes through and explains all this. This is just awesome. It's just super.
Wow.
And that's just in part 1 of the nervous system, which is only in Module 5 of 5 modules.
Yeah, this looks like the most detailed, especially for addressing arthritis. So many people are affected in such different ways. I've never seen anything so thorough before, I don't think.
Yeah, right? And he's got
so
a whole
hopeful.
form. Yeah. So good stuff. Awesome stuff. ArthritisReversalSystem.com.
That's just so cool because, it's like a practical place to start. That's what I think. Because sometimes people, even myself, we listen to these guests on our show and go, okay, that's great. And I'm empowered and I feel, like I want to charge it, but I don't know how to start.
Right.
So that just seems like a really practical place to at least begin taking a step forward.
Oh, man. It's awesome.
Wow.
Really cool. All right, so there you have it, the arthritisreversalsystem.com if you're interested in checking that out. And thanks for being on the show, and please pass it on to your friends. We would greatly appreciate that. And also leave us a review in iTunes if you're able to do that. That would be really appreciated. We'd really appreciate that. Whenever you can, go to iTunes, look up Extreme Health Radio, and rate us and review us. That would be awesome.
Thanks, guys. We really appreciate you guys and everything that you do to keep this show going. So
we appreciate
it's your show.
Yeah, it's your show. And if you guys are looking for other ways to support us, we have our store that you can look at. Check out all the different things in our store as well. So check that out, and that's about it, right?
Yeah, I'm going to go have an empowered afternoon now.
Nice, there you go.
That was great.
All right, everybody, thanks for listening.
And we'll catch you guys on the next episode.
Everybody, this is Josie, Justin's mum. Don't tell him, but I know he would absolutely be really happy if you would sign up to his free weekly newsletter. And don't forget to share this with all your friends. This is the buzzing bumblebee signing off.
Oh, so good.
Oh my gosh.
Thank you for listening to this episode.
It's time to go for now, but our mission does not end with this show.
Justin and Kate will be back with another interview packed full of ideas, discoveries, and unique ways to regain your health.
Head on over to extremehealthradio.com/subscribe and instantly download our free gift too that contains cutting-edge strategies to start making healthy lifestyle changes today.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative